Hi, good evening. I'm Dr. Ashwani Dhar. I'm a doctor from California, and I don't see patients anymore, but I'm involved in a lot of other things. I am into healthcare IT and other startups. So I'm in Mysore today and talking about one of the companies I have in India, which is called as Think Roman Ventures. And we'll talk a little more about as we go along, but I wanted to give you an introduction of where I come from and what I'm doing right now. As I said, I'm a doctor, and I also have a postgrad degree in medical informatics, and have worked in the healthcare IT field and also in other areas of startups like medical devices. I'm also an advisor in the UCSF Health Hub and an investor and advisor of healthcare IT companies in US. And I have some interest in India as well. I have 3 companies which are registered in India, and we are based out of Hyderabad. And Think Roman is one of the companies. And if you were to talk about Think Roman, so Think Roman is a consortium which has different parts to it. One is the healthcare IT software division, and we do some work in AI and ML as well. And basically, I mean, you have heard a lot of AI these days, so it's AI in healthcare, and we have built some tools which are useful for the patient as well as the doctors and young residents. And also just for people who are interested in dermatology and want to look good, we have a virtual dermatologist as well. And I'm going to share the web addresses of that. And we also have a pharmaceutical division. We have medicines ranging from antibiotics to pain medicines to medicines used for vitamin D deficiency, multivitamin medicines, and also medicine for pregnant ladies. So we will talk, as I said, a little more as we go into this conversation, and that's it. So if you want to ask me a question.
Basically, you are from.
So I think one of the things I should have mentioned that I am from Kashmir. So my tagline is proud Kashmiri by birth and American by choice. And I live in the Bay Area in California, and I'm involved both. So if you were to say, my engagements are in America as well as in India. And India is a great country with a lot of opportunities. Especially India is lucky to have a very high percentage of young people, and that is the opportunity. And one of the things which draws us to that there can be innovation, and healthcare is an area where a lot of innovation is needed. Somebody asked me that, so why Mysore? So why are we here in Mysore? So Mysore is a fantastic place. I mean, it's so beautiful. This is my first time to Mysore, and I think Mysore has a great balance of work and well-being. You have got great environment, the lakes around, and I saw people jogging in the lake around here. And we are on that perspective, it is in line with our understanding of keeping a good balance between wellness, well-being, and also healthcare. And as far as what we think is the opportunity here in Mysore is that it has a lot of talent, and innovation is possible. If you look at Mysore, there are a lot of people who are into healthcare, and there are people in technology, and it provides a big pool of talent for us for Think Roman to innovate in healthcare and otherwise. And also I think the other area which I think we have an interest in is, if you look at what we have a few campaigns like the Sunshine campaign, which is for vitamin D deficiency, the awareness of it and the treatment of it, and also Know Your Heart, which talks about heart disease and how do you take care of your heart health. And recently we have started another campaign which we call as the Mother 280 campaign, the 280 days of the pregnancy journey. So usually a pregnancy lasts for 280 days, and we have a campaign. So we want to use that for the community awareness, these campaigns. And I think Mysore is quite a diverse population with an influx of a lot of people working in technology, in healthcare, and also one of our senior directors is an alum of the JSS, and it was his wish that we should come to Mysore and explore. Obviously, he has spent time here in his med school and his postgrad, and I think I'm glad that we did come out here. We have had some great discussions with a lot of private healthcare providers, and also today we had early discussions with a very big health system, which is I think a health system with 37 hospitals all over India and somewhere else. I can't reveal the name, so I will let people kind of understand. So what our other intent is that there is a lot of expertise in healthcare in Mysore. How do we provide a window to that, to the outside world? So we also have a division called as Think Roman Global Health. See, we have very affordable healthcare in India, and we have a lot of experts who, for those people who have been to West and have an understanding, the cost of those services is very high outside. So we can provide excellent quality at an affordable price. And that is the other bridge we want to build between Mysore and the rest of the world. So we recently, a part of my team, including me, were in Delhi and in talks, very early talks with some countries, including the Stans, Uzbekistan, and other places. And those are the areas where we are looking to go into in the future. As I said, these are early conversations, and these need to be followed up with more work and kind of massaging and tweaking that how this is going to work out. That is the other part, because we know that Mysore has a large pool of talent in healthcare and in technology, and that can result in innovation, as Think Roman is part of the healthcare innovation. I would say our DNA is innovation, and we are at the crossroads of healthcare and technology, so to say. And I personally believe that technology should be an enabler in patient care. Ultimately, we should be able to use technology to provide better patient care, and the technology should be patient-centric. So in that respect, we have, even in our healthcare software, so to say, box, we have the telehealth portal, what you have heard of telemedicine, and how to explain that. So during COVID, a lot of people got treated by doctors through video conferencing. In a way, the saying is that what technology and marketing couldn't do for telemedicine, COVID did it in 1 year. So as far as technology, talent pool, and healthcare providers, Mysore has a lot of that. And we want to collaborate with all of those people who are part of that and help us to embed into the society, both from technical perspective, and collaborate with healthcare providers. Ultimately, as such, we want to have an impact and a meaningful change. My personal belief is that no collaboration is good enough if you don't add value or you bring value. And at Think Roman, we have enough expertise in the divisions or verticals I talked about, and there is an opportunity for collaboration in all of these divisions. And I look forward to working with a lot of people here and see what we could do.
So the health sector became a commercial center.
Yeah.
Hence, what to do, sir, for that? People are very interested. Health sector is a noble cause, but now.
So that's a great question. A lot of people say that healthcare has become over commercialized. I think it might be true to a certain extent, but you have to understand that we are in the business of healthcare. So healthcare is a noble part, but somebody has to pay for the healthcare. And in India, it's run in a very different way as compared to where I live in America. It's insurance driven. Of course, in India also insurance is coming. So to provide good quality of healthcare, somebody has got to pay. So now, whether it's over commercialized and what the ethical work of healthcare providers is, that's a point for discussion. And I think there has to be some regulatory oversight on that. That how do we make sure that the healthcare provided at healthcare facilities is of a standard and is also affordable. I also have my thoughts about it that there has to be a collaboration between the government agencies and the private parties to provide that. Because I know in India also you have very big industrial houses and big businesses. I guess they also have to participate. It is a team sport. I have to say that, let us say the corporates, they could provide some incentive to be healthy. So we should not have healthcare only as when somebody is sick and you treat a disease. I think preventive medicine is something we need to spend more on. I've been coming to India for the last 3 or 4 years. There is a shift. A lot of lifestyle changes are happening. And if you see India, there are gyms all over the place. That means obviously people are ready to invest in their health. And that will also be driven by a lot of young population who are coming from or who have the exposure of understanding what healthcare is, and healthcare can be preventive, that it's better to prevent a disease rather than get treated for that. And some of our food practices and others need to kind of improve, and I see a bright spot in young people understanding the importance of that. So costs will come down if you are looking at preventive care. What might take more money to treat a disease, you will need lesser money to prevent that disease. I guess that is what the focus shift has to take place in terms of providing healthcare.
Yes. So, if I ask you deserve and desire, what do you mean? How you describe deserve and desire?
So I think deserve and desire, it's more of a philosophical question. So I think if you were to talk from a philosophy perspective, so I think God has been kind, and I have much more than I deserve. Desire is a very kind of a metaphysical thing, and contentment at a personal level is, I think, a very personal thing. And as you get to travel the world, get an exposure, and then understand how blessed one is, and there are people where the daily kind of day-to-day finances are so restricted to be able to live a regular life, and then you understand how much do you have. And that was one of the reasons I have set up Think Women, where we could have sections of it of giving back to the community. And those are the campaigns we talked about, like the Sunshine campaign, where vitamin D deficiency awareness and treatment. So we have created these web portals where you can go in, and they are very AI heavy or AI back engineered. So you could ask educational things. So what is, for example, what's vitamin D? What is the deficiency? How do you treat it? What should I take to reduce the deficiency? And in fact, you can select Kannada, Telugu, and other languages. So it's not restricted that you need to know English. And similarly for Know Your Heart, as well as the Mother 280 campaigns for people. And these are some of the conditions which are very prevalent in India. So for pregnancies or pregnant women in the second trimester, that's after the first 3 months, the anemia is very common in India. So we have this 280 plus as a medicine, which is a combination of iron, folic acid, and zinc. Our idea is to create the awareness through these campaigns, and we also conducted several camps where we partner with or collaborate with NGOs. They kind of put up some money into it, like buy some of this medicine, and we match that. So let us say you were to give 500 tablets or to 500 people, we'll match it for 500 from our side. We are trying in our way to create that awareness and also give the tools for that. Not only Those are the web tools, as well as we have the medicines and we distribute them.
So for all this, you are doing a very great job. In Mysore, particularly, who is in support with you, sir? Who is supporting you in Mysore?
What?
Who is supporting
As a
you
team.
as a team? Who is behind
Oh, so
you?
that, yeah, okay. So where Think Roman is at, we are a very flexible and agile team. We have we have in Mysore collaborations, and we are working on collaborations, as I said earlier, because healthcare is not just one man's show. But we have Dr. Sarah Huck as our global medical director, who is based out of Mysore and has extensive network into the healthcare. She was at JSS, and she, through her network, is kind of getting us to collaborate with the private healthcare providers, and also we will be setting up some camps, which I told you, and in fact we had some conversation today as well. And we have teams in Hyderabad who are here these today as well. We have a senior medical director with us today. We have the director of BizDev here today. So teams today, it's a virtual world. You don't have to be everywhere, as long as you have a clear path of what you want to do. And we will be, and that is the other thing, as we are collaborating the community, and as I said, there's a large pool of technical people and people in the healthcare. We will be looking at an opportunity for providing jobs as we grow out here. And this is early days. We have been here for just 3 days, and I'm so excited to be here. And the conversations we have had, and very positive, and I would say people have been very courteous and extended the courtesy to us to explore whether it's global healthcare of looking at patients from outside of India coming here and getting treated, or even other of our initiatives, which are these community-oriented initiatives of, let us call them preventive health. Because preventive health is very important, and in societies like ours, where the population is very large, preventive health would be good. And sometimes just the awareness is enough, because eyes don't see what the mind does not know, and we want to provide that information, collaboration, and I would say window into innovation as well as healthcare. As I said, we already have AI tools which can be used by patients, which can be used by healthcare providers, and as of now, we have set them free. All of you can go to thinkroman.ai and use those tools from today. And it has a virtual doctor in it, it has a virtual dermatologist in it, and if you are a medical student, it is things for you. You can learn about the disease. If you are a resident working in a hospital, or you are an ER doctor, it has AI tools for you. And we will be growing it as well as we get to understand what the requirement is. And this is all, I mean, you start a journey somewhere. And I think from what my interaction has been here, and I have to say that my senior director, Dr. Sigbert, has proven me, like he has proven right in his understanding, because as I said, he is a JSS alum, and he thinks, and I agree with him, that Mysore is a good mix of where there is talent, and there is also a good balance of, I would say, work and well-being. That is something which is very perceptible. I mean, you come here and you feel relaxed already. So, and I hope that as people get to know more about Mysore, there will be more of engagement from people all across the country, as well as we will take this message out as well. And we have network all over, and I think it will be a good win-win for all of us.
So lastly, as far as India is concerned, so in America, what do people think about India?
Okay, so I guess the perception of India is changing, and changing for good. I mean, you see now, I mean, I don't have to count the number of CEOs from India in US. I mean, some of the most like big companies have CEOs who are from India. And I live in the Bay Area, and we have one of the most diverse population you can have. And we have technology folks from India. We have doctors from India. So perception of India if you were to talk 10 years back and now, is completely different. India is seen as a progressive, on the front foot, and our Prime Minister has a great following in USA. And also, I think it's not only the technology portion, it is the RRR movie getting, like, people know that we produce quality, and we are a nation who is a good nation to collaborate with. We are one of the top people in all the fields right now. I think it's a proud moment to be an Indian right now for people from India. And I have to tell you that I come across young people who are very assertive of their identity. And as I said, my tagline is, I'm a proud Kashmiri by birth and American by choice. So even I am proud of where I come from. And it's great to see young people keeping their identity and being proud of who they are.